A national trend is currently being explored as public smoking is up for debate. Melbourne CBD recently experienced a trial smoking ban, and now the University of Newcastle is following suit with the implementation of a smoke-free campus. With the exception of a few dispersed smoking areas, the campus will transition to smoke-free as of July 1st of this year. According to the university, these areas will be at least 10 meters from any enclosed areas, doorways, and windows, away from public transport stops, sporting facilities, and childcare facilities, off pedestrian walkways, and away from areas where food may be consumed. Dr. Stephanie Brookman, Medical Director of University Health Services, explains that the international community shows a higher rate of smokers in comparison to the domestic students.
Our experience is that international students tend to have higher smoking rates than domestic students. I think Australia's done very well to reduce the smoking rates in our communities, whereas overseas the rates are much higher, and so you see that reflected in the students who come here as well.
The correlation between international students and smoking will surprisingly grant more smoking areas near on-campus accommodation coming July 1st.
We have had feedback on the smoking areas, and we're happy to change that. The feedback will run until the 18th, so we're happy to take feedback on board, and we've already relocated 2 zones, moved them across, or removed them completely if it didn't suit, or if we needed extra ones, like at the accommodation, we've added a couple of extra because students, you know, they live on campus. Yeah, so we need to make sure they're safe, especially at 1, 2 o'clock in the morning.
And while the additional areas are necessary to keep students safe at night, it does not mean that the university promotes the habit. Instead, the university is looking to promote healthy lifestyles among students and staff. Several smoking cessation programs will be offered in conjunction with the smoking ban in order to ease the transition while quitting.
If you're a smoker, you can take up the smoking cessation telephone program. So that's 6 free sessions with a qualified psychologist who specialises in addiction. They will talk with the person, 6 free sessions at a time that suits the individual. They will also get free patches and replacement therapies as well. We also have a pharmacy here at Callaghan who's happy to offer free packs and specialist advice as well. And we also have our EAP counselling service for our staff members, which is completely free for 6 sessions. And for our students, we have the free counselling service as well. And the counsellors are also trained into how to deal with addiction or refer our students and staff members to people who can help.
Starting July 1st, the cessation programs will be heavily promoted across campus, with the hopes of encouraging well-being amongst staff and student smokers. Additionally, the changes will make non-smoking students breathe easier, as the ban will clear walkways, bars, and other public areas of secondhand smoke.
I guess it's probably a good thing. I mean, it's pretty gross having other people's habits like that imposed on you everywhere you go. It happens quite a lot in this area actually, and it's not really nice.
Eventually the smoking areas will go, but hopefully it's given people enough time to get used to the idea, and also, like I said, to take up the smoking cessation programs as well.
And although smoking on campus will still be partially permitted, the university plans to go entirely smoke-free in coming years.
I think it's probably a good thing, get anyone who doesn't want to smoke away from all the passive smoke.
I think that as a GP myself, my medical background tells me that this is a really good thing to be doing, and we're already seeing some benefits with people actually deciding to stop smoking because of the university's non-smoking policy.
Faith Tribby, UON News.